People with lumbar spinal stenosis are either going to have low back pain, leg pain, tingling, numbness, weakness, and some burning maybe down in the feet. It's going to come about and be triggered by things like walking, standing long periods of time, or both daily activities around the house, pushing, pulling, lifting, little trivial things around the house. The accumulation of that can create the symptoms of lumbar spinal stenosis. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. I have moderate severe lumbar spinal stenosis. In this video, I'm going to show you A through Z and what you need to know about lumbar spinal stenosis, what causes it, what's the best way to diagnose lumbar spinal stenosis, and the best treatments for lumbar spinal stenosis. And what spinal stenosis is a narrowing in the canal where the nerve needs to carry message from the brain down through that canal and the vertebrae to the target organ or muscle or down the leg, and it needs to carry messages back up to the brain. And when you get that pressure on those areas, we'll give you those symptoms. You can have a central canal stenosis, where it's right in the center of the vertebrae where the spinal cord goes, or you can have the peripheral foraminal stenosis where the spinal nerve can get closed up. You can have both of those. The number one cause of lumbar spinal stenosis is going to be osteoarthritis. The number one cause of osteoarthritis is going to be an injury. So you get an old injury to the spinal joint, the joint locks up, it doesn't move properly, and that never gets fully restored. So you go around with this restricted motion within the spinal joint. In order for joints to be healthy, you have to have motion because they're meant to move. And if it doesn't have that motion, then you get a lot of pressure within the joint, a lot of stress in the joint. It irritates the nerve. It's going to cause a malfunction to the muscles. The muscles become imbalanced and create more stress on the joint. It'll create adaptive curve changes in the spine, and that creates more pressure on those joints. And over time, that increased stress, and if you couple with things like poor posture while you sit and at work and lifting and bad mechanics as you lift and twist, that will add more pressure to those areas that are already weakened, and it can create osteoarthritis. Osteoarthritis is where you're going to have the bone spurs and thickening of spinal ligaments. You have maybe the broad-based disc bulges, swelling within the joint. All that will narrow that, and then over time, and it gets more and more narrowed, then it will put pressure on the nerve material that going through there, and that gives you the lumbar spinal stenosis and the symptoms that we talked about before. The best way to diagnose lumbar spinal stenosis is through an MRI. Just not a flat MRI. The best way would be if you're doing an upright, a sitting, or a standing MRI, to where it puts more gravitational stress on all those ligaments, discs, and see if what pressures are actually be putting on the spine. It'll give you a much clearer picture of what your lumbar spinal stenosis looks like. Before you start any type of treatment program, you should understand some of the goals of the treatment. Is it merely pain relief? Or are you going to get some long-term benefits, some correction, maybe some functional and structural corrections that's actually moving you towards a cure? You definitely understand the safety factors. Is the treatment going to do you harm? How safe is it? These are all the things you got to review before you start any type of treatment program. But then the first thing you have to do is you have to identify what the triggering factors are throughout your daily activities that are going to trigger the pain. So you got to analyze the way you stand, the way you sit, the way you lie down and sleep, maybe your sitting position at work, your sitting position as you drive or as you walk. These are all things that you got to look at and see where you need to improve. How about the position and posture as you're just moving around and picking up little things throughout the house or using good mechanics? You got to look at these things, because accumulation of these things, if not corrected, puts a lot of stress on the areas that are already under stress. Those joints are under stress, and it irritates the area. And if you don't correct those, it will continue to make it sensitive and inflame those areas. So you need to look at these areas so you can desensitize the area and avoid those, modify them and change them, and allow you to get ready for more structural and functional type of rehabs. Now, as far as it goes with treatments, if you go to your medical doctor, he will give you most likely medications at first. And the idea of taking the medications, or maybe shots, is that you can use things like the easy way would be is over-the-counter, would be like ibuprofen, Advil, Motrin, or maybe if you're using a steroid shot. Those are good for short term, maybe give you some swelling, decreased swelling and pain relief. Doesn't give you some long-term benefits. In fact, some of the risk factors is that interferes with the body's ability to regenerate the joints by interfering with the production of the proteoglycan, which is going to rebuild your joints. So actually over time, if you continue to do things like the medications and the steroid shots, it actually weakens the joints and it makes lumbar spinal stenosis worse. If you're thinking about surgery and you're seeing a surgeon, there's a bunch of different options that you can have. It really depends on the surgeon. It depends on you and what's going on structurally. He's going to look at to see, well, maybe it's just a disc bulge. Maybe going with minimal invasive type of surgeries like the discectomy and trim out the disc, or you can maybe need to decompress it and increase the hole, do a laminectomy, bore out some of the bone spurs, maybe use some spacers, maybe need to stabilize it by using a fusion, put bolts into the spine and secure it, maybe with one vertebrae or a couple vertebrae, maybe even to the sacrum. So all these have their benefits. The idea is they're just trying to relieve the pressure in there to relieve the symptom. Now the shortcomings, of course, are things like infections are a problem. And also whenever you cut that area, even if it's the smallest cut, it's going to create damage to there and it's going to change muscle attachments and it's going to change the biomechanics of the spine to where it's never going to be the same after that. Also, it always creates scar tissue. One of the most common causes of a second surgery after lumbar spinal stenosis surgery is cleaning up the scar tissue from the first surgery, because scar tissue will thicken up and it'll create a narrowing in that lumbar spinal stenosis and create the same problem that you've been trying to correct. So the success rate of lumbar spinal stenosis surgery at best is going to be about 35% is what the research shows, which means not a great success, but really it should be just reserved for emergency situations, like things like cauda equina syndrome, to where maybe you're getting pressure on the nerve so bad to where it interferes with the bowel and bladder functions, or maybe you're getting drop foot. In that time, it's going to be an emergency situation where you got to get in there right away to where you can decompress that area, hopefully save the nerve to where you can restore those functions again. So spinal surgery at best should be reserved for emergency situations only. Now, if your goal is more of having maybe functional and structural rehabilitation area, you want to decrease pain for long-term basis, permanently, hopefully, along with pushing your body more towards a better function, better structure to where it's going to stop the lumbar spinal stenosis and maybe get some reversal of that, push it towards a cure. Then your goal would be is more of the functional, structural type of rehabilitation. So with physical therapy, they specialize more in functional type of rehabilitation. They would do certain things like give you ideas on what not to do at first, avoid extension exercises, because extension exercises have a tendency to close down and make that stenosis more narrow to where it'll aggravate it at first. So they give you more flexion-based exercises, abdominal crunches type to where it will flex the spine, open up those holes more, so it'll relieve some of the nerve pressure, allow the nerve to rest and the area to heal up, desensitize it, and get it ready for more of a rehabilitative type of rehab. Abdominal strengthening, glute strengthening, that helps stabilize the spine to where it'll prevent any micro movements in the spine, prevent the pain, and keep it stabilized as you're moving around with your daily activities. Also give you functional type of corrective exercise, maybe increase function of the hips and the low back and other areas of the body that are secondary to the lumbar spinal stenosis. With corrective chiropractic care, typically they would do an upright full spine x-ray, maybe a motion x-ray. They determine the gravitational stresses on the spine. They would see specifically which areas they need to adjust, restore the motion. And once they're able to restore the motion with their adjustments, it'll allow better motion, it'll free up the nerve, it'll decrease pain, it'll allow better function of those muscles, and it prepares it more for the spinal rehab. Also, they use specific tractions and exercises to promote the proper lordosis, proper curves. So when you're doing the functional exercises of physical therapy, it'll allow those to become more effective. The people that are going to get the best results from their care, they're going to take responsibility, they're going to understand this, they're actually going to put in the time and the investment in their own body to get the best results that they can. Now, if you want to get relief from walking from lumbar spinal stenosis, check out this next video. Or if you want to understand more exercise routines for lumbar spinal stenosis, look at our other video.